Hi, I'm Dr. Dan Byck, orthopedic surgeon here in Ogden, Utah. This is Slide and Ride Healthy. Today, we'd like to talk about the three main injuries that people will encounter while skiing. One is your ACL tear, anterior cruciate ligament. 2, meniscal tear, that little ring of cushion that really supports our knees. 3, patellofemoral problems. You know, that aching pain that you get when you get home from a big day banging the bumps. It's a beautiful day. You're down making your turns, you're having a great time, get a little back on your skis, and all of a sudden you're crashing and burning and you feel a pop in your knee. It hurts a bit, but not that bad. You think you're pretty good. You shake it off, you're there for a couple minutes, and you get up, and when you try to ski down, boom, your knee gives out. That's an ACL tear. This fella's trying to get forward, and if he hits a bump, he'll probably end up falling backwards. This fella here is also leaning back. He's not getting forward quite enough. His hands are by his hips. We want to see him out in front of him. That'll push him forward a little bit, and he won't be sliding his turns quite so much. The one that's most commonly seen in our offices is called a meniscus injury. Occasionally, if our knee is turned just the wrong way and we put pressure on it, we can actually crack that meniscus. We think about, well, what can I do to help prevent that? But it's very much like the anterior cruciate ligament prevention program. Conditioning, balance, agility drills, staying forward. In other words, if you're skiing in a normal flexed position, you're not pressuring that little ring of cartilage in an abnormal way that would lead to a meniscal tear. It's when we get off center, off balance, come down hard on it, that we can crack that little baby. What about that more chronic problem that just about everybody you know has, the patellofemoral arthritis? Patella is your kneecap. The femur is the thigh bone that the kneecap rides through a little groove in at the knee. And what happens is it puts so much pressure on that thin cartilage under the kneecap that it wears out with time. You start to feel sort of a little bit of a grind or maybe a click under your kneecap. After the end of a big day skiing, maybe hitting the bumps real hard. So that is something that we treat much less with surgery and much more with steroidals and icing and strengthening exercises. People come up to me all the time and ask, what can I do to help prevent ACL tears on the mountain? Things that you can do are really things that anybody can do. You don't have to be a member of the US ski team.